Hey everybody, video number 2 of the day. Well, technically it's after midnight, so it's actually the next day. September 10th, 2021. I didn't really plan on making another video this soon, but when I got home earlier, there was some news of the day that seemed appropriate to make another video about. It has to do with President Biden's announcement on some new ideas, some new techniques that he's going to implement to combat the global pandemic in this country. So, first of all, you may notice it looks a little different. It sounds a little different here today. That's because I'm in my garage. Like I said, it's after midnight. My kids are asleep. I'm trying to keep it that way. So I thought this was the best option. And I just wanted to get this out quickly. Let's start off with saying that YouTube's got some relatively extensive rules on what you can say and cannot say on this topic. So for the purposes of tonight's discussion, I'm going to use the George Gannon method of discussing this topic. If you've watched any of George Gannon's videos on this topic or his podcasts, you'll understand what I'm talking about. But for the purposes of this discussion, like George, the illness that is sweeping the globe right now will be referred to as bananas. And the recommended jab to keep you bananas free, we are going to refer to as the medicine. Right. You don't have to tell me. I agree. All right. So starting off, I just wanted to let everybody know. I mean, obviously, bananas is a serious thing. It's a real thing. And you should do what you can to avoid bananas. There's things you can do personally. Stay healthy, eat right, try to build up your personal immune system as much as possible. That being said, there are artificial tools you can use as well. Artificial tools to put on your face. There's an artificial tool that you can have injected into you, the medicine. That being said, the choice of using the medicine, I believe, is a choice between you and your doctor. Obviously, some people in the government think differently, and I'm going to jump into this CNN article that I came across that discusses his comments today, and I'll link the video to the channel and to the Facebook page. CNN, President Joe Biden on Thursday imposed stringent new medicine rules on federal workers, large employers, and healthcare staff in a sweeping attempt to contain the latest surge of bananas. The new requirements could apply to as many as 100 million Americans, close to 2/3 of the American workforce. Quote, "We've been patient, but our patience is wearing thin. And your refusal has cost all of us," Biden said, unquote. Biden said, his tone hardening towards Americans who still refuse to receive the medication, despite ample evidence of their safety and full approval by the U.S. Food and Drug Administration. He said, medicated America was growing, quote, frustrated, unquote, with the 80 million people who have not received shots and are fueling the spread of the bananas. And he acknowledged the new steps would not provide a quick fix. So, moving on here. At the center of Biden's new plan is directing the Labor Department to require all businesses with 100 or more employees to ensure their workers are either medicated or tested once a week. Companies could face thousands of dollars in fines per employee if they don't comply. So I saw that, and immediately I had a flashback of the CDC. The CDC, now the Labor Department, creating rules that hold the force of law, even though they're not laws. So, moving on here, postal employees also will be required to be medicated or face mandatory weekly testing. The Postal Service, a quasi-independent agency, employs more than 640,000 people. Biden also signed an executive order requiring all government employees to be medicated. So, he said 300,000 educators in federal Head Start programs must be medicated, and called on governors to require medications for school teachers and staff as well. A potentially massive impact on the U.S. workforce. You think? And Biden announced he would require the 17 million healthcare workers at facilities receiving funds from Medicare and Medicaid to be fully medicated, expanding the mandate to hospitals, home care facilities, and dialysis centers around the country. So, being fairly well versed in the healthcare universe, virtually all healthcare facilities are receiving funds from Medicare and Medicaid. So most are going to fold like a cheap suit from this threat, no doubt about it. Basically, you get the medicine or you close your doors, or you're fired. Those are the choices. So a lot of people are going to do just that. Now, that being said, they bill this as they're going to keep patients, safer in the medical facilities by doing this. But in my opinion, this is actually going to do the opposite. It's going to drive people from the healthcare field. It's going to create more stress on the people that stick around. There's going to be more people calling in, not able to make it through the entire shift. It's going to put a huge drag on the people that stick around, and many, probably a large component of them, I've seen it with my own two eyes already. Before this mandate, people that are of retirement age don't want to deal with it, so they're going to retire. They might even retire early, and then you're going to be more short-staffed. And when you're short-staffed, you know what happens? Patients wait longer. Patients get less quality of care. Patients don't have access to as many nurses, doctors, professional staff. So, just from what I know, I think this is going to have the opposite effect on the healthcare field and patients that the medical staff care for. Moving on, the new, quote, emergency temporary standard, close quote. The new emergency temporary standard. Whenever the government says temporary, keep your fingers crossed, but we'll see how temporary that actually is. From the Labor Department, will require large employers to give their workers paid time off to get medicated. If businesses don't comply, the government will, quote, take enforcement actions, which could include substantial fines up to nearly $14,000 per violation, according to officials. So, each employer will decide exactly what they want to do, but what we're saying through the Department of Labor rulemaking process is a minimum of testing once a week or full medication, a senior administration official said. So again, in the Department of Labor rulemaking process. So I don't remember voting for any rule makers at the Department of Labor, but again, they are now making rules that hold the authority of law. Creepy. The new announcements move beyond what Biden announced earlier this summer when he required federal workers to be medicated, but allowed for those who opted out to be subject to stringent mitigation measures. Now, federal employees will have 75 days to get medicated or risk being fired. So do it or you're fired. That's the expectation. And as a matter of fact, the next line is, quote, "The expectation is if you want to work in the federal government or want to be a contractor, you need to be medicated," close quote. Press Secretary Jen Psaki said, adding the number of unmedicated federal workers was still being compiled. Okay, so again, you don't have to take the jab, but if you don't, you're fired. Those are your choices now. If you want to keep your job, do what we say. Otherwise, find another job. And at the other job, if it's over 100 people, well, you got to take it there too. All right. Biden on Thursday also announced a major expansion of free testing, a step public health officials have said is critical to containing the bananas, particularly as children return to school and some to workers return to offices. Okay. All right. At least that's not as intrusive as the medicine. Moving on. In addition, Biden called on large entertainment venues to require proof of medication or negative testing for patrons seeking entry. And he said the Transportation Safety Administration would double fines on passengers who refuse to wear masks on planes. Okay. Here's a quote: "If you break the rules, be prepared to pay. And by the way, show some respect." Close quote. He said, chastising recent incidents of air rage. All right. For me, I just choose not to fly right now. There's just too much nonsense and potential problems, getting on the plane. And it's geared to protect the traveling public, what he's talking about right now. But in my opinion, it's likely also going to have the opposite effect. I mean, it's probably actually going to have that effect. It's going to keep the traveling public safer, only because there's going to be vastly less people traveling by air. There already is a huge drop off in air travel in the last number of weeks, maybe months at this point, but airlines are bleeding right now, bleeding passengers, and this is just going to make it worse. And again, they're trying to do A, but when they try to do A, B happens because they didn't think things through completely. They do this a lot. So just to wrap things up, let's just think about this logically and critically for a moment or two. We know the bananas are contagious. We know that bananas can mutate, not just this bananas, but other types of bananas. That's how all the types of bananas live. They mutate. That's why we have a different flu shot every year. We don't just get it once because there's mutations. So this is biology. It's the same type of. It's the bananas, but it's a different kind of bananas than the one we're used to getting, the different one of every year. So this medicine will likely have to change, just like the bananas are going to change. And it's likely not going away. So, if it's not going away, if you can nod your head and say, yeah, you're probably right, it's not going away, then what are we doing? I mean, unless we are prepared to lock down this country like as a perpetual police state, with neighbors informing on neighbors, and your business basically at the mercy of bureaucrats, some maybe even in Washington D.C. that have never even met you, never spoken with you, never even don't even know what you look like. This is going to be with us for a while, and if we know this, we have to think critically about if we're prepared to sacrifice freedom for security, for safety. Because, again, it's a serious thing, bananas, but even worse if we allow unelected bureaucrats to do this, it's going to be hard to get freedoms back. And when you have a business and it's yours, but you can't do what you want, the government has got the authority to tell you exactly how to run your business, who to employ in your business, who you can serve from your business, who you can do commerce with, or perhaps even worse, is that your business, or is that the government's business? And perhaps even worse, if the government can tell you you have to get this medicine even if you don't want it, is it really your body, or does it belong to the government? So again, not saying that the medicine is good or bad. I myself did the cost-benefit analysis, did the risk-reward, and I got the 2 doses. So I made up my own mind. It was a choice between me, my doctor, my family, and for my personal situation, that's what I did. But in my opinion, that's what it should be for everybody. But I'm not telling you that it's bad or good. What I am asking you to do, though, is just think long and hard. Think logically, think critically. This is going to be with us for a while. And if it's going to be with us for a while and we know that, are we prepared to give up our rights, our constitutional rights? Because once you give up your rights, once they're removed by the government, they're really hard to return to you, to get back. So think on that. I welcome your comments. I hope that we see some interesting comments on the channel and on the Facebook page. And I will be back with another video soon. In the meantime, follow me. 11B.